Arts, I'd like to tell you that the humor also has limitations. As you can see, that the Chief Minister of Maharashtra is not very happy with one of the comedians.
Uh, Good point you raised, Arun. Please don't be a comedian in your practice. Use of humor and being a comedian are two totally different things. All those of you who are married have already developed a sense of humor because you've been suffering and you need some way out. So you're better at it than those who are unmarried starting practice. But a sense of humor and wit in our clinical communication is important, and it's unfortunately not taught in textbooks. So why is it necessary to have a sense of humor and speaking skills? See, patients come to you after you've, especially for those who develop white hair early, because they come for a second opinion many a times. Nowadays, patients are doctor shopping, so Google is opinion 1, doctor 1 is opinion 2, they come to you for a third opinion. So many patients have been frightened by another eye surgeon. He's told them you got a macular hole and I don't know whether it will close, it's quite big, we can try, but then you never know, you might lose whatever vision you have, you'll be blind. So all these things have been told, now they've come to you for an opinion. Or they've come to you first time and you're seeing a macular hole and you have to tell them something like this. But you have to couch it in a way that the patient will not get frightened and walk off before you finish telling them everything. So you need to put the patient at ease, then they'll be more receptive to what you're saying. Important thing for youngsters who are starting practice is that your speaking abilities will set you apart from your competitor in initial stage of practice. I experienced this. I had a very fierce competitor in the same, who shared the same waiting room and clinic, one Dr. B.T. MASKATI. And we shared the secretary also. So the secretary would tell the patient that, what have you come for? She had been with him 40 years and she asked, what have you come for? And if he said, for glasses, I'm 40 years of age. Go to junior Dr. MASKATI because he will spend half an hour with you checking your number and giving you the correct glasses. Senior Dr. MASKATI will spend not more than 3-4 minutes. His fees are double. And the important thing is, if you're not satisfied with junior Dr. MASKATI, you get a free consultation with senior doctor. So all these tips and tricks she used, because I had all the time in the world. I had one patient in an OPD, sometimes if I was lucky, 2 patients in an OPD. So I had all the time in the world to chat with the patient, to refract him, re-refract him, put drops and refract, call him again a second time for post-mydriatic test. All these things I could do because I had no patients at that time. So that is a time when you can actually capture the patients, see how patient you are with them. Explain to them with examples they can understand. So the important thing is you have to go to the IQ level of the patient and explain. It's all very well to have computers and laptop by which you show them things, but they get frightened of seeing a picture of an eye. They've not seen it. So I tell them that the eye is like a camera. The retina is like the film in the back of the old film cameras. And if it's a youngster, I tell him you won't understand. But if he's come with his father, I tell him you understand. No, old film cameras, our time. So then they follow. So the retina is like the film at the back, and the lens is like the lens of the old film cameras. So I explain to that first. Yes, I have models, I have color atlases, everything, but I first give them a little bit of imagery, and we get into laughter about old times and things like that. Humor should be subtle. Don't ever tell patients jokes. Just because you have the time, you can't tell them, have you heard this one or have you heard that one? That is, they think you're wasting time. So let's take a few practical scenarios. Doctor, is my cataract ready for surgery? So I tell them, I'm not too sure, is your pocket ready to spend? So then it immediately, I'm already talking to them about commercials. Is your pocket ready to spend? So then they start smiling. I tell them, look, whenever you are ready, whenever you feel that your vision is such that it hampers your lifestyle, then we'll operate. Then I give them an example. I said, you know, if you were Mukesh Ambani, and you had to sign a $1 million check every day, and if the signature differed a little, government would fall. I would operate it today evening. But if you were Mukesh Ambani's mother, who has to see only the large print of the Bhagavad Gita and is not interested in TV, I think we could wait for 5 years with the type of cataract you have. So I have explained to them, I have not told them anything wrong. I have told them that yes, if you want, you can do it tomorrow. But if you want to wait, we can wait. Ball is in your court. You'll be doing my surgery by laser, no? Everyone has heard laser. Even before femto came in, people were talking about phaco as laser. So I tell them that I'll be doing the surgery by what people call laser, by what most people call laser. So again, I'm covering myself. I'm not doing femto. I'm telling them that we're doing a surgery which most people, because most people who are doing phaco are calling it laser. Which IOL is the best? So I don't have many people have a huge menu card of IOLs, right from rigid PMMA Indian, rigid PMMA foreign, and so on. So I've got 9, 10 different varieties. By the time I go to EDOF, trifocals. So I tell them there are only 2 types of IOLs. One is monofocal, where we try and correct you for a particular distance. One is multifocal, where we try and correct you for multiple distances. And the others are all first cousins and second cousins on the mother's side and on the father's side. So you leave it to me. We discuss only whether he wants monofocal or multifocal. And then he says, which of the multifocals is best, doctor? I've heard of Alcon, I've heard of J&J. So I tell them, see, when you go to a restaurant, you ask for kali dal, because you know that kali dal is very nice, you like it, you don't like yellow dal. Irrespective of the price, you choose kali dal, because you are the expert. The waiter doesn't tell you have kali dal. But when you come to me and I'm telling you, you've decided on multifocal, you leave it to me. I have discussed with you, I've talked about your lifestyle, what you need it for. I will put the best lens that I feel is possible, because here I am the expert. If I tell you that this costs 100 rupees and this costs 150, you will say, doctor, put the best one. So I will put the best one. So we never, 95% of my patients have no idea which company IOL I'm going to put, or whether it's a trifocal or an EDOF or whatever it is. I have discussed with them their needs and I say, this will suit you. So there is a way of putting things to the patient such that you're not telling them lies, but at the same time you're protecting yourself. You're not showing yourself inferior to somebody else. I never use topical anesthesia. I'm one of those old school. I do peribulbar for everybody. Now they've heard of topical anesthesia. They go around, they say, doctor, you'll be using only drops, no? If you're using it, you say, yes, I'll use only drops. But here I'm not using drops. But I'm not inferior to somebody else. So what do I tell them? I said, if you want, we'll do it under drops anesthesia. Don't blame me if I shout at you for not looking where you're supposed to look, if I scream at you during the procedure, and if something goes wrong, if I blame you because I have somebody else to blame, you moved. No, doctor, you do whatever you think best. So, you leave it to me. So this is the way you don't show yourself inferior, but use a little bit of humor in your practice. You guarantee I will not need glasses after surgery. No, I don't guarantee you any such thing. Do I guarantee you that when you walk out from my clinic, you will not die of a heart attack on the 5th step of I'm on the 1st floor, on the 5th step of my staircase? No. So nobody guarantees anything. Medicine is not playing with computers. I guarantee that I will try my best to see that your requirement of glasses is the least. But your eye may not behave the way my computer expects it to behave. Means putting the fault on him. It's not that my calculation error, but your eye did not behave the way I expected it to behave. And my computer has got an algorithm of 50,000 eyes. Still your eye did not behave that way it should have. So you will get a number. It's possible. In glaucoma, I find it difficult to remember my eye drops. Is it okay? Yeah, it's okay once in a while, but establish some system. If you have somebody else in the house, ask them to remind you, set an alarm. Will I go blind, doctor? So if the patient is got a risk, actual risk of going blind, you tell them, we will try our best to protect whatever you have. You already come very late to me. We'll try our best to see if we can keep you going as long as possible. You're not using the word blind, but you're putting it in a way that is more palatable for the patient. And can you restore vision in my left eye blind due to glaucoma? No, it's like the heart which is dead. You can't revive it. Similarly, your left eye is dead because of glaucoma, it is optic atrophy. Nobody in the world can revive it. Nowhere in the world can it be done. Even if you are Dunya ka Raja with crores of rupees, it cannot be revived. So that you tell him that he doesn't go doctor shopping. And similarly with retinoid or any other, I'm not sure what the timing structure is, but why is this surgery so urgent? So why is retinal detachment surgery urgent? Doctor, I've got my beti ki shadi, something like that. So I tell them, no, it's not urgent. It is only urgent if you want to have a reasonable chance of getting good eyesight. Otherwise, it is not urgent. You can come back to me after 6 months. It will be more difficult at that time to do it. We'll still attempt it. You'll still pay the same fees. But at the end of the day, instead of telling you 70% chance of success, I'll tell you 20%. So you convey it with a little bit of humor, but you drive home the points that you want to. How do I get rid of my floaters? I tell them, look, I'm married. I get floaters. Sometimes you realize your wife is standing in front of you, your spouse is standing in front of you, and she's been talking for 5 minutes, but your mind is elsewhere. You have not noticed her. If you have not noticed a 5 feet 6 inch person in front of you, why are you keeping on noticing these microscopic floaters? Just ignore them as you have been trained to ignore your spouse. So little bit of humor there, telling them that something just like a spouse, you have to suffer them. You have to suffer the floaters. One fine day they will go away. I can't say the same about your spouse. So I invite you to ask me questions. Just pretend to be a patient. Ask me any question related to something which a patient has asked you. And let's see if we can give them an answer which is a little more palatable. This is some of the examples I gave you are just one way of managing. You can have another way of managing. There's no right or wrong here. And the important thing is not to get defensive or irritated, irrespective of the question. Yeah.
Very nice tip, sir. How you explain to a patient about the postiopolar cataract?
Sorry.
Actually,
yeah?
sir, we have overlasted the time. Okay, we can just take this quick question and we'll...
Yeah. What is the question?
How you will explain patient about the postiopolar cataract?
Yeah. So I tell them, it's important to tell them first. I tell them that, look, you got a peculiar type of cataract, maybe because of the steroids you used or you were born with it or whatever the thing may be. But it's the capsule at the back. I tell them that it's like a shopping bag. And the shopping bag, the lining of the shopping bag is very worn out. And it can break on its own. It may be broken, which we don't know. But while I'm operating, it is possible that that thing can break. We will try and be very careful. We'll use all safeguards. But I may not be able to put the lens that I'm planning to put. I may put a different type of lens in the eye. And there is a very, very rare chance that I might have to have a second surgery in case while I'm operating, the whole lens falls into the back of the eye. Nothing to be alarmed about. But after a few days, we'll get that out and then put an appropriate lens. Mostly everything will go off well, don't worry about it, but this can happen. So you tell them, but don't scare them away. It should not be so scary that he will go to somebody else who will say, kuch nahi hone wala hai. Maine hazaron case aisa kiya hai. All will be fine. That is wrong. So you stick as close to the truth as possible. Yeah.
Sir, I think time is up.
Thank
15
you.
minutes.
Thank you.
Okay.